Every single day, people who eat well, exercise regularly, and have no warning signs whatsoever drop dead from a heart attack. No chest pain before, no dizziness, no nothing, just gone. And nobody talks about why this actually happens. Doctors call it a silent killer, but the truth is it's not silent at all. Your body was screaming the whole time. You just didn't know what to listen for. Today I'm going to tell you exactly what's happening inside your arteries right now, why the healthiest looking people are sometimes the most at risk, and what you can actually do about it before it's too late. Let's start with a name. Tim Russert. If you don't know him, he was the host of Meet the Press, one of the most respected journalists in American history. He exercised. He was being treated for his heart condition. His doctors knew about it. And on June 13, 2008, he walked into his office, sat down, and died of a heart attack. He was 58 years old. Or take Bob Harper, the trainer from The Biggest Loser, a man whose entire career was built around health and fitness. In 2017, he had a massive heart attack in the middle of a gym while he was working out. A gym. While exercising. These are not rare stories. They happen every single day to people you would never expect. So what is actually going on? To understand this, you need to forget everything you think you know about heart attacks. Most people imagine a heart attack like a pipe that slowly gets clogged until nothing can get through, like a sink that backs up. That mental image is wrong, and that wrong mental image is literally killing people. Here is what actually happens. Inside your arteries there are these things called plaques. Think of them like little pimples growing on the inner wall of your blood vessel. Now, some of these plaques are big and hard and calcified. And yes, those can cause blockages. But the dangerous ones, the ones that kill without warning, are actually the small, soft ones. The ones that don't even show up clearly on most standard tests. These soft plaques have a thin cap on top, almost like a blister, and when that cap ruptures, your body panics. It thinks you're bleeding internally, so it sends clotting factors rushing to the scene. And within minutes, a clot forms that completely blocks the artery. That is a heart attack, not a slow clog. A sudden explosion of a tiny soft blister inside your artery, and it can happen to someone with arteries that look mostly clear. Now here's where it gets personal. Who is actually at risk for this? Because the answer is going to surprise you. Yes, obesity matters. Yes, smoking matters. Yes, a terrible diet matters. But research now shows that up to 50% of people who have heart attacks have normal cholesterol levels. Half. Think about that for a second. Half the people dying of heart attacks would have passed their standard cholesterol test. So why are we still only testing cholesterol? The answer is complicated and honestly a little frustrating. But let's get into the real risk factors that most doctors don't spend enough time talking about. The first one is inflammation. Chronic low-grade inflammation is now considered one of the most important drivers of heart disease. And what causes chronic inflammation? Stress. Poor sleep. Processed food. Gum disease, yes, gum disease. Gut bacteria imbalances. Air pollution. Even loneliness. Your body is in a constant low-level state of alarm, and over time that damages the inner lining of your arteries, making them more likely to develop those dangerous plaques. The test you want to ask your doctor for is called a high-sensitivity CARP test. CARP stands for C-reactive protein, and it measures inflammation in your body. Most doctors don't routinely order it. You have to ask. The second hidden risk factor is something called Lp(a). Say it like Lp(a). Lipoprotein(a). This is a type of cholesterol particle that is incredibly sticky and incredibly dangerous. It promotes clotting, it promotes plaque buildup, and here's the scary part, it is almost entirely genetic. You can eat perfectly, you can exercise every day. And if you inherited high Lp(a) from your parents, your risk of heart attack is dramatically elevated. And the truly terrifying thing is that most standard cholesterol panels don't even test for it. You have to specifically ask for an Lp(a) test. Studies suggest that up to 1 in 5 people have elevated LPRA, and most of them have absolutely no idea. The third factor is insulin resistance, not diabetes. Insulin resistance. This is the stage before diabetes where your cells stop responding properly to insulin and your body has to pump out more and more of it to manage your blood sugar. Insulin resistance causes inflammation, it damages blood vessels, it raises triglycerides, and it lowers your good HDL cholesterol. And here's the thing about insulin resistance, you can have it for years or even decades before it shows up on a standard blood sugar test. The test you want is called HOMA-IR, or you can ask for a fasting insulin level. Not just fasting glucose, fasting insulin. Big difference. The fourth factor is something almost nobody talks about. Sleep apnea. If you snore, if you wake up tired no matter how many hours you sleep, if your partner says you stop breathing at night, you need to get tested immediately. Sleep apnea causes repeated drops in oxygen throughout the night. Every time your oxygen drops, your body releases a surge of stress hormones. Your blood pressure spikes, your heart races. And this happens potentially dozens or even hundreds of times every single night while you think you're resting. People with untreated sleep apnea have a dramatically higher risk of heart attack and stroke. And because they feel tired all the time, they often just attribute it to stress or aging and never get checked. The fifth factor is emotional stress, and I don't mean this in a soft way, I mean this in a hard biochemical way. When you are chronically stressed, your body produces cortisol and adrenaline. These hormones raise your blood pressure, increase inflammation, make your blood more likely to clot, and directly damage the walls of your arteries. There is even a condition called Takotsubo cardiomyopathy, also known as broken heart syndrome, where extreme emotional stress can cause a heart attack even in someone with perfectly healthy arteries. Grief, rage, terror, these are not just emotional experiences. They are physical events happening inside your cardiovascular system. Now let's talk about the people who exercise a lot, because there is a paradox here that needs to be addressed. Regular moderate exercise is one of the best things you can do for your heart. Nobody disputes that. But extreme endurance exercise, marathon running, ultra triathlons, years and years of intense training, there is growing evidence that this can actually cause a different type of heart damage. Studies have found higher rates of coronary artery calcification in long-term marathon runners compared to non-runners. The theory is that extreme repeated stress on the heart over many years can cause inflammation and scarring in ways that increase certain types of risk. This does not mean don't exercise. It means more is not always more. And it means that even athletes need to get their hearts checked. So what should you actually do? Let's make this practical. The first thing is to get a comprehensive cardiovascular panel. Not just total cholesterol, you want LDL particle number, not just LDL cholesterol. You want LPRA. You want high sensitivity carb. You want fasting insulin. You want homocysteine levels. Homocysteine is an amino acid that when elevated damages blood vessel walls, and most doctors don't routinely check it. These tests exist, they are not experimental, you just have to ask for them, and sometimes you have to push. The second thing is to consider getting a coronary artery calcium score test. This is a special CT scan that takes about 10 minutes, it's usually not covered by insurance but costs around $100 to $200, and it literally shows you the amount of calcified plaque in your coronary arteries. A score of 0 means very low near-term risk. A high score means you need aggressive intervention now. This single test has changed and saved countless lives because it shows you what's actually happening in your arteries right now, not what might happen based on risk factors. Third thing is to take sleep seriously, not as a lifestyle choice, but as a medical priority. 7 to 9 hours of quality sleep is not a luxury. It is when your body repairs blood vessels, regulates blood pressure, clears inflammatory compounds, and resets your stress hormones. If you think you might have sleep apnea, get a sleep study. Many can now be done at home. Treating sleep apnea has been shown to significantly reduce cardiovascular risk. The fourth thing is to manage your stress with the same seriousness you manage your diet. Meditation, therapy, walking in nature, time with people you love, these are not soft suggestions. They are cardiovascular interventions. The research on mindfulness and heart health is now strong enough that major medical institutions are incorporating it into cardiac rehabilitation programs. Your emotional life is your heart health. The fifth thing is to look at your gums. I know this sounds crazy, but the research on periodontal disease and heart disease is consistent and strong. The bacteria that cause gum disease can enter your bloodstream and trigger systemic inflammation. People with severe gum disease have significantly higher rates of heart attack. Flossing and getting regular dental cleanings is genuinely heart protective, and almost nobody talks about this. Now let's talk about warning signs. Because while sudden cardiac death can happen without classic warning signs, very often the body does send signals. The problem is we dismiss them or misattribute them. Chest pain or pressure is the one everyone knows, but heart attack symptoms, especially in women, often look completely different. Unexplained fatigue, jaw pain, back pain, nausea, shortness of breath with minimal exertion, a sense of doom that you can't explain. Women having heart attacks are significantly more likely to present with these atypical symptoms and are significantly more likely to be sent home from emergency rooms without proper evaluation. If something feels wrong with your body, push. Advocate for yourself. Demand the tests. Let's talk about what happens in the moments of a heart attack. Time is muscle. Every minute that passes during a heart attack, more heart muscle dies. The phrase in cardiology is time is muscle. If you or someone around you has symptoms, do not drive to the hospital. Call emergency services immediately. Chewing an aspirin if you're not allergic can help, and when the paramedics arrive, tell them you think it might be a heart attack. Do not minimize your symptoms. Do not say it's probably nothing. The cath lab where they can open the blocked artery needs to be activated, and every minute matters. Modern medicine can do extraordinary things. Stents can be placed in blocked arteries within an hour of arriving at the right hospital. Clot-busting drugs can dissolve the blockage, but only if you get there in time. And only if you recognize what's happening. Here's what I want you to take away from all of this. Heart disease is not a mystery. It's not entirely random. It's not just something that happens to old people or unhealthy people. It is a process that takes years to develop, that leaves evidence in your blood and your arteries, and that can be detected and interrupted if you know what to look for. The tragedy is not that we don't have the tools. We do. The tragedy is that most people never ask for them until it's too late. Get the full panel. Know your LPA. Know your carb. Know your calcium score. Sleep. Manage stress. Take care of your mouth. And if something feels wrong, listen. Your body is always talking. The only question is whether you're paying attention. Share this with someone you love. Because chances are someone in your life is walking around with a ticking clock in their chest and they have no idea. And now you know what to tell them.